Hi, I'm Neil Manchester, and this is TouchPoint, our BioTouch video series where we share real stories and conversations from the healthcare field. Because every patient, every sample, every delivery we make, every kit that we build, every touchpoint has a purpose. In each episode, we talk with experts and thought leaders about how we're working together to touch lives and improve outcomes. Today's episode takes us to the red carpet at the Executive War College, where Robin Hooker talks with Lloyd Gravois of Ochsner Health about the challenges of running a healthcare system in the Gulf region, where weather-related disasters Katrina and Ida threaten critical healthcare operations and services. This is TouchPoint. Genetics, what are we talking about? And now for the interview. The backdrop is from the Executive War College in New Orleans, a leading conference for lab operations and management. Robin led a panel discussing healthcare logistics and diagnostics, and this is a truly fascinating follow-up interview. Here's Robin and Lloyd.
All right, Lloyd Gravois. Hey, it's good to see you.
Seeing you, Robin.
Right, we're here at the Executive War College on lab and pathology. And we just wrapped up a panel with Lloyd on the panel. Lloyd is with Ochsner Health Systems. Lloyd, can you give us a little background? Tell the audience about Ochsner and your role at Ochsner and why it's critical.
Okay. Ochsner is a regional healthcare provider for the Gulf South. We started in 1942, but really became a force in the Gulf South after Hurricane Katrina, when we started to reach out into the community and rebuild the healthcare network that had collapsed during that time.
Wow. Yeah.
So we have now disparate clinics all over the area to bring healthcare to the patients instead of them coming to us. And that's really where we work with BioTouch, being able to tie the transport of specimens and products back and forth to all those different locations throughout our network.
Criticality of specimen movement in this health system that expands outside of New Orleans.
That's correct.
Right?
That's correct.
To the whole regional area.
Covers the Louisiana, Mississippi, and part of Alabama. So,
right, so it's a large network, good footprint.
Mm-hmm.
It requires a lot of coordination of specimen movement and maybe other items that are moving in a courier network as well.
That's correct. Yeah, that's correct.
So everything hums along normally. Katrina happens, and I think during the panel you mentioned that the state hospital system started to fold at that point?
Sure. So what we had was we had some for-profit hospitals that did not make it through the economic impact of the storm.
Wow.
So they were trying to leave the city. So that was our first group of hospitals we brought on. Then the state of Louisiana had their own hospitals and decided that they didn't want to have those hospitals either.
Yeah, so it's a 1-2 punch.
Exactly
really.
right, exactly.
Wow.
So then we brought those hospitals, or some of those hospitals, into our network. There are others with other places. But it gave us the opportunity then to reach out into the community with hospitals instead of just being here in New Orleans.
Yeah.
And bring everybody to the city.
And you're folding in complex courier networks of multiple hospital networks into like the Ochsner standard of business.
That is correct. And at least those original ones didn't even have infrastructure, right? They had already started to fail.
Yeah.
The state ones did, and we've had some others we brought on since then. But it is bringing them to the network that we've developed with BioTouch for the Ochsner clinics and lab, which is centralized in New Orleans.
Yeah, so what's important to your courier network? Visibility, tracking, temperature?
Exactly. So we utilize a lot of technology that we've interfaced with each other to be able to utilize data when to pick up product, specimens in particular, when they were picked up, and then how do we ensure that the right temperature throughout that process. And we use barcoding and handheld scanning for that process that we've integrated between the two groups.
Yeah, so that visibility is interchanging between our courier drivers, their pickup locations, their clients, if you will, clinical sites, and the lab, right? All that's mission critical. And you're no stranger to BCP and disruptions, though. So it disrupted, and hospital systems folded into Ochsner, which grew Ochsner. You absorbed and coordinated that sort of courier network, and now there's more storm activity.
Exactly.
Right? Fast forward to...
So Hurricane Ida. So in the past, we only had to worry about New Orleans because that's where we were. Now we have to worry about the whole Gulf Coast, which is where we get hit by quite a few hurricanes.
Wow. And so even if you're out of the path, you're still in the path.
Exactly right. The health system is in the path somewhere.
Yes.
Right?
Yes.
So we are really susceptible to hurricanes. But when Hurricane Ida came through, it missed the city, but hit our hospitals that were in the Bayou region. So we were working to maintain healthcare in those areas. But then the power grid in New Orleans collapsed. So when the power grid in New Orleans collapsed, one of the main things that affected us courier-wise was there is no fuel. So you can't pump the fuel out of the fuel tanks, correct?
So were you hand cranking a generator?
Exactly, yeah, how do you do it, right? So, but it wasn't just Ochsner, it was the whole city, right? And so we worked with BioTouch to come up with a process of bringing in fuel trucks, and we provided secure locations and security, and you guys provided the trucks and the fuel. And what we were able to do was keep that network going because the center, the city, was out of power, but all the regional areas had power. So our clinics were all up and running.
Oh.
And the lab was running.
Yeah.
We had no way of making sure we had fuel to be able to bring everything back and forth. So we were able to do that, and we did that even after the grid came up, because of course then everybody in the city was trying to get fuel.
Yeah.
So we kept that going, and it was a great opportunity for us as partners to make sure that we sustained the healthcare in our area, even through some dramatic changes that the environment threw at us.
Healthcare doesn't stop just because there's a storm, just because there's a disruption to power, disruption to fuel supply. Healthcare continues.
Without a doubt.
Right? Power is needed, fuel is needed. It's interesting to hear BioTouch being involved in the fuel aspect of this, because I wouldn't think, but it sounds like you made the call. We sort of rose to the occasion to help.
100%.
Really, really proud of that. That was before I joined the organization. But I love hearing these stories. BioTouch has an internal mantra about touching lives, or touch lives and improve outcomes.
Exactly.
And I feel like that's similar at Ochsner, right? That we're dovetailed on that.
Exactly. Our vision is healthy lives and strong communities, right? And that's what we're trying to do with our network, is to build that process.
Lloyd, I want to thank you for making time to share your insights with our panel audience. We had a full house today.
We did.
And I think they loved hearing some of the storytelling about BCP and how you plan, but you never plan, you can't quite plan for everything.
Exactly.
Great stories there. Thank you for coming. Did you get any insights from kind of being here and being at these events?
Meeting with other companies that are doing a home collection.
Yeah.
That's an area where we're growing, and so it gave me a great opportunity to meet other people and learn about those
the folks from Tasso, from Irigen.
Exactly.
Home health is probably part of the Ochsner strategic plan.
It
makes sense. New venues of care, pushing it out there. We hope that BioTouch can be a part of that in the future and continue to be a part of your courier network going forward. Thank you again for joining the panel.
Thank you.
Really enjoyed it.
Right, you too.
Great, Lloyd.
Thank you.
Take care.
Stay tuned for another episode of TouchPoint. And as always, comment, like, and subscribe.